Welcome to any new participants. Apologies, we have resent the link to anyone who got bumped off, so we do apologise for that, and it should be in your email. A quick reminder, there is a Q&A box at the base of the Zoom window where you can send through any questions. So our next speaker is Professor David Gilchrist. David is a chartered accountant who holds a PhD in economic history from the University of Notre Dame, Australia. David is currently Professor of Accounting and convener of the not-for-profits UWA Research Group at the University of Western Australia, where he is also Chief Investigator and convener of the Australian Non-Profit Accounting Standards Project. David is a member of the Australian Accounting Standards Board Academic Advisory Panel, and he has previously held roles as Assistant Auditor General in WA, as well as teaching accounting at many fine universities in the UK and here in Australia. David has collaborated globally with universities in not-for-profit research. In particular, David has undertaken significant research related to sustainability and the NDIS, very close to our heart. So amongst other things, he was author of several reports presenting the results of a longitudinal study focusing on NDIS sustainability for disability service providers, and published many articles and books related to the area. David was also appointed a Fellow of the Western Australia Parliament in 2021. So David, I'm going to stop talking about you and let you talk. I'll stop sharing my screen and hand over to you. Welcome.
Thank you very much. I will share my screen and then we'll get underway if we can. Thank you, Alison, for that great introduction. Just making sure that can people see my screen okay?
Yep, it's perfect. Thank you.
Oh, good. Okay. Thank you again, Alison, for that great introduction. And I hope the session has been going well, and look forward to presenting today as well on what I think is a really important topic, particularly with the new government ensconced in Canberra. What can the sector expect, and what might the sector be seeking in relation to how we might improve the way we undertake things relating to not-for-profit human services, particularly in this country? Before I do anything else, I'd just like to say, or pay my respects rather, to the Whadjuk people of the Noongar Nation here in Perth, from where I'm presenting, and also acknowledge the elders past, present and emerging of all of those First Nations people around the country from where people are participating in this particular event. Okay, so let's get underway. In terms of the screen, you'll see or notice that we've got this first slide, which is really, I guess, trying to set the scene in terms of what our prospects are for improving our situation in the not-for-profit human services sector. And as I mentioned, my work is really around not-for-profit human services rather than in broader not-for-profit areas. So I'm going to speak principally to that particular area. So things like disability services, aged care and so on are really falling in the remit that I want to talk about. Okay, having said that, my agenda is really then to identify two things. The first thing is, well, what are the key issues? And I think we need to have an appreciation of the key issues in order to then understand what the government might do or what we might ask it to do going forward. And I make those two categories are really important, I think, because at the end of the day, I think the sector really needs to, and has an opportunity to indeed stand up and to be pushing a program of reform. I'm also very happy as I go through the project presentation rather to have any questions put into the chat room or to chat with anyone at the end of the session. So I'll leave 5 to 10 minutes for question time if that helps everybody. The other element that I want to talk to is the prospects for change and what kinds of things that I think need to be changed in order for us to be successful and to continue to have a sustainable human services sector in this country. At the end of the day then, in terms of the key issues, I see that there's two fundamental groups of key issues. One is an overt group, and I think the kinds of things that I'll speak to in relation to this group you'll recognise fairly much straight away. The other group is what I've labelled a covert group, which I think is a breakdown of some really key issues that are probably less spoken about across the sector and perhaps less discussed in policy circles as well, but which I think are no less important, and perhaps actually drive more significantly the kinds of things that I think are important for this sector to be thinking about. In terms of the overt key issues that the government and I think the sector need to address together include, of course, funding. funding is an incredibly important aspect to all of the processes that go on in terms of making a sustainable human services sector in this country. I'll talk to funding a little bit more, but I do think there's three things that are probably important for me to say at this point. The first point is that I think human services in this country have been underfunded consistently for at least 2 decades and perhaps even longer in relation to two fundamental things. One, what is the cost of service delivery? And what's the nature of that service delivery and how is it to be presented? In other words, I think that in relation to funding, we don't really understand what the comprehensive cost of service delivery is, and therefore funding itself is not really presented in a way that meets the requirements of the sector in terms of a sustainable service, but rather is set up to be able to fulfil the requirements of policy, but also to meet the costing arrangements that have been allocated in the actual budget from year to year. I'll talk about that a little bit more shortly, but I think this funding issue is an absolutely fundamental element that needs to be rectified and that has been, I think, outstanding on the list of things to do for 20 or so years now. The other element that I think is really important, of course, is workforce. And workforce is something that I'm sure many people in the room would be aware of and be concerned about, particularly in some of the states that are impacted by mining and other aggregation or other quite significant economic activities. So Western Australia and Queensland, for instance. But I think it's fair to say that there are workforce shortfalls across all of the sectors and across all of the jurisdictions in Australia for a number of reasons. I think the final point in terms of the overt elements is the administrative burden that's represented by a number of program elements. NDIS, aged care and so on, all increase administrative burden, and our research is demonstrating categorically that administration costs are going up because of the administrative burden relating to not only the programs themselves and articulating with government, but also because at the end of the day, things like having very, very flexible workforces mean that we need to have very flexible administrative processes to be able to pay those people and to be able to manage those people. And all of that costs money, of course. Again, I'll talk a little bit more about administrative burden and the concept of red tape as we go through the presentation. In terms of covert elements, and again, I'm saying these are covert, not because at the end of the day, they are things that we haven't been talking about, but I think they're not quite the headline things that they should be. And I think the sector really needs to consider these items quite fully in terms of how they approach government to see effective change. The first element that you can see there is what I would term a lack of investment. And that lack of investment is in the sector to be able to meet the policy changes that have been implemented successively, particularly over the last 10 years, but to be able to allow these organisations to reinvent themselves and to respond to that change. In other words, when we implemented things like the NDIS, we didn't really have an understanding or an investment in that sector to be able to support it to meet the change that was required. And that change comes both in terms of human resources management and also in terms of infrastructure and other processes that need to be put in place. And I think that's why a number of organisations have burnt a lot of capital and really reduce their sustainability in terms of cash reserves and so on in order to try and meet that change requirement. Without being able to invest in change, organisations can't meet the policy outcomes. And I think that's a really important lesson for us, particularly, as I say, in relation to the NDIS over the last 10 years. I think the other element that is really important and I think a critical issue for the sector to address, and that is the use of competition and the use of what we call faux market arrangements. So talking about markets and talking about pricing and other rhetoric, but also trying to put in place what we call quasi-markets to be able to somehow meet efficiency gains that seem to be thought to be extant within the sector. What am I talking about here? I'm talking about using market economics to drive the way we think and using competition in a way to try and achieve outcomes in terms of efficiency that I'm not entirely sure are actually evidenced in any of the research that's been undertaken around the sector. So in other words, I think there's two fundamental issues here. One is that governments and commentators, policy setters, often talk about competition and markets, thinking that the market mechanism is actually going to create the outcomes that we would like to see, when in fact there isn't a market mechanism in place. It is a funding rationing system, and government actually is paying money or procuring services to be able to implement their policy arrangements. So I think competition and those faux market arrangements are things that need to be revisited in the context of the following points that I'm going to raise. The first one is a need for local decision making. That is that for efficient human services to be provided, there needs to be decision making at the coalface, so that those people involved in the provision of services and in receipt or participants of those organisations that are actually receiving those services are able to make efficient allocation decisions at the coalface, rather than having them made in Geelong or Canberra or somewhere else. That doesn't mean that there shouldn't be a national governance framework and policy framework guiding those decisions, and of course budgetary arrangements to support those decisions. But we're seeing what we've termed market failure, so thin markets or services not being delivered across a number of human services, just simply because there's not the ability to make the right decisions at the right time where those decisions count. And again, I think NDIS is probably a good example here, where we've seen very significant underutilisation in terms of funded services of up to 30% a year not able to be fulfilled, because I think largely there are decision-making processes that aren't able to be undertaken at the coalface to support those service delivery. I think the other element that is really important is a legacy of commercial influence over the governance of these organisations and how they operate. And I think that combines with the economic discussion that I raised a little bit earlier about using markets rhetoric or discussions around market to try and drive behaviour. But I think at the end of the day, commercial board members and other people that are involved in this sector and influencing this sector have not necessarily appreciated the risks associated with poor service delivery or the nature of service delivery in terms of human services in this country. And so I think there is an ongoing issue around how we use commercial operators' capacity to be able to influence the way we might respond to things within the sector, but at the same time being in a position to appreciate the variance and differences in the sector, and perhaps even deepening the experience of those directors within organisations who volunteer their time and effort and are very good people in terms of doing that, but at the same time don't have the deep understanding of the industry that they might be expected to have if they sat on a commercial board, say in mining or some other sector. And so I think there is a real need for us to look at the way we govern the sector and the way we liaise with commercial operators in order to be able to understand better what they have to offer, but also to be able to influence and inform the directors who are volunteers in these organisations to be able to understand the depth of the sector much more readily. I think that also goes partly the way in terms of funding and investment that I talked about before, where organisations are unable to invest fully in their organisations so that their directors who are volunteers actually understand the industry a lot more deeply than they might otherwise. The other element that I think is really important, and we're starting to come to grips with this, but again, I don't think it's really spoken about enough in terms of the sector, and that is in relation to the understanding of the economic contribution of the sector. As an economic driver, as an employment, I think at the national level we have discussions about these things, but I don't think we really understand the full economic opportunity that's inherent in the sector and how government investment in the sector and support of the sector is actually a good economic decision for our country. At the end of the day, I think things like being able to provide commercial organisations with fuel tax rebates and other things of that nature goes against some of the investment that could be used, or that money rather could be used elsewhere to be able to actually invest in this particular sector to drive the economy even more substantially. The final point then that leads me into, and I'm speaking very fast because there's a lot of points to cover, but at the end of the day, I think tax reform is absolutely critical to the sustainability of this sector. One of the things that we're constantly hearing about is making sure that the funding arrangements for human services are continually sustained and maintained. And at the end of the day, I think it's really critical that we are looking at taxpayers to ensure that at the end of the day, they're actually contributing what they need to contribute to be able to support these organisations in the work they do and to ensure there's sufficient money. At the end of the day, I think there is significant opportunity there to allow the government to reform taxation to ensure that its tax collection is sufficient to support the sector and the other social policy frameworks that it's putting in place. So I think the other element is, though, that's perhaps a little bit frustrating for, I'm sure, many in the room who have been in this sector for a long time, and that is that these things have been known, certainly in terms of those overt issues, for well over a decade. And we've talked about these for well over a decade. Things like workforce was recognised as being a major issue around 2010, and that there was prospects for change in that area that was going to really test the sustainability of human services right up until this point in time. And I think those prospects, those forecasts have been shown to be true. I think the other elements in terms of those covert elements that I've raised have always been spoken about in some way, in some context for well over a decade. And tax reform particularly, I think it's fair to say that it's probably 15 or 20 years overdue. And so these things have been talked about at a national level and in a holistic context. But I think the sector really needs to start raising these issues in order to be able to reset the focus of government in terms of the economic value of the sector and what it actually contributes. So what are the attributes of a strong human services sector? I think having said all of those things about what is missing or what are the challenges of this sector, that the attributes of a strong human services sector actually fall out of some of these drivers. And as you can see in terms of this particular slide, things like a strong partnership between the sector and funder. So genuine collaboration in terms of costing and also in terms of planning, setting aside the idea that there's markets and setting aside what I think are ridiculous conceptions of price signalling and other market economics rhetoric that is simply not working, and I think it has been shown not to work. At the end of the day, that strong partnership is absolutely critical to be able to collect the data that's required to understand what investment and what costs need to be covered, and also to make sure that we're able to prioritise between the sector, between advocates for service participants, and also between the government to ensure that we're arriving at the right investments at the right time. I think the other element that is absolutely critical is price sustainability. I mentioned earlier that at the end of the day, pricing is largely driven by the appropriation that's available rather than by the comprehensive cost of service delivery. And I think this is a fundamental weakness across human services in Australia. And again, I think has been demonstrated under the NDIS and also in aged care. And perhaps even the Royal Commissions into both of those programs have identified the key issues that have arisen because we just simply don't have that price sustainability or funding sustainability. Importantly, that funding sustainability needs to be both in terms of operations, so ongoing operations and service delivery, but also, as I mentioned before, that investment requirement in order for organisations to be able to meet the challenges that they have. One of the things that we're doing here at UWA is developing an indexation framework for the human services sector in Australia in order to demonstrate the deficiencies in current indexation arrangements and also to be able to make suggestions about how indexation might be done more effectively to ensure that sustainability. At the end of the day, strong evidence base and the ability of the sector to be able to contribute their data to this evidence base is absolutely critical for sustainability going forward. I think alongside the local decision making that I raised earlier, flexibility in funding and in creating the system is a really important issue. looking at funding from a systemic perspective rather than from a program perspective, I think is absolutely critical. And one thing that we haven't done for many years, how does the system actually respond to the needs of people rather than how do specific programs respond to more specific or identified needs in that regard? A systemic view means, I think, that will have the opportunity to allocate funding resources to appreciate more effectively the funding gap, particularly if we have that evidence that I talked about earlier, and also to appreciate what the priorities might be, both between government funding arrangements and also what philanthropists might contribute, but more importantly, perhaps how organisations in the sector can arrange themselves to meet those priorities more effectively. As a result, I think there is a real need for us to understand that comprehensive cost of service delivery, as I mentioned before. But one thing our research is telling us quite clearly is that, particularly over the last 5 years, those costs have escalated very significantly. So comprehensive costs need to be funded, including things like the provider of last resort in the case of areas like disability services. But also that comprehensive cost needs to be understood, and changing business rules around providers into the sector need to be thought through as well. So things like that flexible workforce requirement means that there is more payroll employment costs, payroll staffing costs, administrative costs, but so do quality assurance programs and other programs require more administrative burden in order for organisations to meet their regulatory and other requirements. There's nothing wrong with those regulatory or other requirements, but they do cost money to present. And at the end of the day, that money needs to be included within the funding framework in order for these organisations to be sustainable. But also, perhaps more importantly, in order for those recipients of services from these organisations to get the services that they need in order to live their lives appropriately. Again, local decision making is absolutely critical to this, not just in terms of being able to understand when someone wants services, but also to be able to understand how those particular services from a program perspective can be systemically incorporated into broader services and how we can gain efficiencies in that regard. One of the key issues that I think the sector needs to be very, very responsive to is the fact that failures in human services end up costing governments a lot more money in their primary health costs and also in education and other subsidiary costs. If we don't think about human services in a systemic sense, then we fail to recognise those costs and fail to recognise the opportunity that exists in the human services sector providing some of those supports and transferring money out of the health budget to be able to do that. So therefore, I think a systemic planning regime is absolutely critical, which would include a number of things, including having the sector and service users involved in the planning process. I'll come back to that shortly. So a systemic perspective, I think, is a really important issue for us to consider. A systemic issue or systemic perspective rather means that we have system value, and that system value equals public value. It's an investment that the country has made over many years, and it means that the sector is actually a national asset. We can invest as a nation in the sector and make the sector more efficient and effective through a number of processes, including that collaborative planning process that I mentioned before. We need to approach policy as part of the national infrastructure building program. We need to think about things in much more longer term views, so medium and longer term views, rather than markets rhetoric that's talking about the very short term and making sure that there's money in that short term. Now, that doesn't mean that we don't need short term increased funding to be able to support the sector more effectively rather and to maintain that sustainability. But we really do need to collect data to understand what the comprehensive cost of service delivery is, and also understand what the difference is between need and demand in economic terms. In other words, we understand what demand is because we know how many plans have been issued by the NDIS. We know how many beds are available under the aged care system and so on, but we don't really understand what need is in terms of what's out there in the community and who needs what supports and services in order to live their life to the fullest that they can. So I think there's also an element of intellectual property and experience there. as well as, I think really importantly, the sector is irreplaceable. And I think this is a major issue in terms of the sector's positioning in our national discussion around how we might build our communities. And when we talk about markets and market economics, we have this inherent sense, I think, that one provider is as good as the next, that for-profit is as good as not-for-profit, and so on. But what we are forgetting is that this sector is one that actually has many years of experience, but more importantly, much more contribution to make. And so I think we need to protect the sector to make it sustainable, but to also protect the sector to protect the national investment that we've undertaken over a long time. As such, I think the overall message for me is that in terms of government liaison and going forward, the sector needs to respect that it is a critical part of the whole human services system, but it's not the whole system. And I think government also needs to recognise that in order for human services to be successful going forward, we need to have that strong collaboration in order to build that ability to plan more effectively and have better foresight, but also better investment to ensure the priorities that we all share are actually met. What does that mean in terms of prospects? I think there's a few things that are really interesting for me. We have a new ministry, and I think a ministry that is demonstrating that it is a much more collaborative ministry than perhaps it has been before. And I think the Prime Minister has probably demonstrated that over the few weeks or months that he's been in that position. I do think one of the other attributes or advantages that will accrue to the sector is the fact that the ACNC Minister, Andrew Lee, is someone that's always wanted to be Minister of this particular portfolio, to hold this portfolio, which is very different, I think, to previous ministers. And I think the Minister comes with a very strong appreciation of the sector, having written books and other things in relation to it, but also having a strong appreciation of what regulators and others can do to support the sector going forward. And I think both those things mean that there's a real opportunity for the sector now to strike out for a much more collaborative and systemic view of human services delivery beyond just the rhetoric around funding and trying to achieve those short-term gains that might have come out of them recently, particularly in relation to the Royal Commissions. I think there is a lot still to learn from those Royal Commissions, but perhaps more importantly, more to bring up in relation to those Royal Commissions, and to be able to use the evidence that's been gathered and the considerable taxpayers' funds that have been spent in gathering that evidence to actually drive a more systemic and holistic policy going forward. I think there is a few things, though, that might be really important in terms of the substance of this particular presentation. The first is, I think there are prospects for a lighter touch regulation, returning to the regulatory processes that we had experienced in the first iteration of the ACNC under Susan Pascoe. And I think that's something that's really quite exciting, and an opportunity for the regulator to not only consider whether people are doing the right thing, which of course is absolutely critical, and I'm sure everyone in the room would agree that we don't want charities wandering off and doing things that are going to be bad for the whole sector or for the community, pardon me. But I do think we do want a regulator that actually supports the sector and provides information and other things to the sector to be able to maintain that sustainability and to build on it. I think the other risk, though, is that we'll get more of the same regarding the economic and policy frameworks unless the sector steps in with an alternative view and really uses this fresh ministry, this fresh opportunity to drive some really substantial, and I think probably fundamental cathartic change in terms of how the government, the sector, and also those people that rely on the sector for services and supports are able to collaborate more effectively to drive the way the sector might be funded, but also how that we respond to priorities and how the sector's work is articulated into the broader policy framework. So I think unless we have a better view of the way we think that the sector should be structured and how the system should be structured, I fear that we will just simply have more of the same economic type policies and funding policies that we've had up to this point in time, which, as you can no doubt gain from my demeanour up to this point, or my message up to this point, we're not really satisfied in terms of that, that current infrastructure. Unless what then? So what should happen to make things work a little bit more effectively? What should the sector be going to government to say and to try and drive in order to be able to build that true sustainability going forward? I think the first thing that the sector needs to do is to take a systemic perspective. And that means understanding not just how individual organisations and services sit within that system, but also how the full system operates and what are the opportunities for efficiencies and effectiveness in that regard. What does that mean, or how does that manifest? I think at the very top level, and I'm really happy to take questions and comments on this, and also to learn from people about this as well. So when these slides are distributed, my contact details are there, and I'm really happy to extend the discussion if that's something that people would like to do. But at the end of the day, I think there is a real need for investment in an industry planning framework and a national reporting structure that really drives human services development in this country. A framework like that would have a responsible level of investment in systemic analysis. And I think this is very, very true. We don't know really what need is out there or what the demand is. And we really don't know how the system hangs together. We've got very much a programmatic view of the world rather than a systemic view of the world. And I think in order for us to be able to understand that, we need to be collecting data and analysing that data both within the sector and at government level, using organisations like the Australian Bureau of Statistics, for instance, to be able to, if you like, at arm's length and independently pass comment on the sustainability of the sector and how it goes forward, particularly in relation to things like cost indexation and how that might work. The other thing that might be really important is a responsible level of investment in systemic construction. And I think that includes in terms of the development of governance frameworks that allow for local decision making, that allow for differential funding depending on the called Indigenous or other community requirements that might mean that different ways of funding might be more effective in terms of service delivery and outcomes. It also means that we understand the system fully and report on how the system's operating, including in terms of what it costs state and territory health systems, primary health systems, to be able to support those people that are not supported by the system, so where the system actually fails. I think this is some of the black hole lack of transparency that means we don't really know what the true cost of human services is and what the political cost, if you like, is going forward if we don't rectify these things. A responsible level of investment in public sector capacity, I think, is also important. One of the things in our research that we've identified time and time again is the fact that while public sectors have policy frameworks in terms of funding arrangements, they don't necessarily invest in their staff that are sought to implement those processes. And I think that lack of investment is really telling. If government has a policy, but the public sector can't implement that policy, it really means that we come down to the lowest common denominator and we end up reinventing wheels and also undertaking same, which of course is not really working at this stage of the game. The final point there then is that all of this should be done with a genuine partnership structure, including executive capacity funding and public transparency. So in other words, we need to have much more collaboration, much more determined focus on what the system needs to look like to achieve the outcomes that we need to achieve, including really hard outcomes, solid outcomes, obvious outcomes in relation to things like the NDIS and aged care, so that we're actually reporting the whole system's effectiveness in terms of pursuing those outcomes and not just simply looking at what the government has done or what the sector has done or what others might have done in relation to this particular service delivery environment. Okay. That's all I really wanted to say. I know I've spoken very quickly, but I'll be very happy to take questions and comments.
So we do
Alison,
have a
should
number
I-
of questions that have come through, David. A number of people attending today obviously are executives and board members of not-for-profits. So in terms of the fact that we've got a structure where we've got state-based requirements, we've obviously then got federal, and then you're talking about local. How on earth can we, combine our efforts and essentially get the government to listen in terms of being part of this whole process?
Yeah, look, it's a really interesting question, and it's a real conundrum in many respects. And I've included a lot of points that I could probably do a presentation on the points alone, let alone. So I recognise too that there's a lot of territory being covered, and so probably a lot of questions in that regard. But I would say first and foremost, in Western Australia, for instance, we've had a number of structures where we've had, from the government side, local area coordinators, very similar to what's being discussed across, say, the NDIS environment. We've had those coordinators in Western Australia since 1987 or something like that. I can't remember exactly. But what we see in that kind of process is the ability for local control, not necessarily local formal governance or regulatory requirements, so that local people have to be regulatorily responsive at the local level. And I certainly think that we need to have one national regulator for all of these things. I don't think having state regulation is really all that helpful. But at the end of the day, when I talk about a regulatory regime, I'm talking about a regime of policy that sets out what the framework or attributes of those decisions might be, how you allocate resources in those areas, and then how those providers might report back on what they've actually done in relation to service delivery and how they've used that money.
Okay, fantastic. So, I've got to say, I feel very sorry for Minister Lee. With the cost blowouts on NDIS, he must be feeling like a bit of a deer in the headlights. If you had him in the room for 5 minutes, how would you advise him in terms of where to start, who to listen to, where would you go?
I think it's perfect time for a reset. In other words, what I'm advocating is that we come back to develop what we call an industry plan. So if we looked at mining, if we've looked at university change in this country, where the federal government allocated millions of dollars to universities to be able to change their focus and do things to meet policy requirements. So there's two things that I think are absolutely critical. One is a ground up understanding of how we need to deliver services in particular environments and in accordance with particular elements of care and supports, but also how do we construct the system so that we're actually reporting on the things that are important to report on in terms of those cost outcomes and having transparency. So I think there's a number of things, but what I'd be saying to Minister Lee is, and he doesn't carry the responsibility for this. Of course, the Minister for NDIS and so Bill Shorten and others carry more responsibility here. But I would be looking at a national framework for actually developing industry plans in these areas. And those industry plans, in my mind, need to be developed by the Commonwealth, the states, and the service providers and advocacy agencies collectively. Otherwise, we're just simply not going to move forward, and we're going to do more of the same that we've done over the last 30 years of my career anyway.
Okay, so that leads nicely to the next question, which is the for-purpose sector and the commercial sector, both providing services to, on a social basis. Do you feel that there is room for further commercialisation versus for-purpose?
I think this is part of, so I actually left things out, believe it or not, in the presentation because I knew I wasn't going to have time to cover it all. But this is, I think, part of the industry planning process and the transparency process. You're quite right. There's a lot of commercial organisations providing these services. And when we look at the very top level, we can make that statement. When we actually get down underneath and look at the nature of the services and what we call the service mix, so what is it that these organisations are actually providing? Cherry picking is a phenomena that is being discussed and I think is absolutely representative. In other words, a for-profit organisation is not going to to support or undertake a non-profitable undertaking. And this is not just an Australian phenomenon. I mean, there's 30 years of evidence in the United States and the United Kingdom and elsewhere to show that these organisations do cherry pick and do certain things because the not-for-profit sector, to put it bluntly, will pick up those services that are not profitable, and they will continue to provide those services. Now, I'm not saying that people are evil for doing what they do. At the end of the day, if you're a director of a for-profit organisation, of course, you must make a profit and you must make decisions accordingly. What I am saying, though, is that the system needs to be developed so that we do have those for-profits doing the things that they're best to do because the evidence says that they're best to do it. And that might also mean that government might have to do things because they're best to do it, because that's what the evidence says. And it might mean that not-for-profits and charities too. So I guess what I'm saying is I'm actually agnostic in terms of who delivers what. What I'm concerned about is the lack of evidence to say and to demonstrate that actually this idea of for-profits are more efficient, more effective, et cetera, which is a big mythology that's built up around this sector. And there's no evidence to support any of that. And in fact, the international evidence actually obviates against it. It says that's not the case. And yet we still persist in doing these things without having the evidence to decide which way to go.
I think there'll be a few CEOs out there that want to get their mitts on some of that data, David.
Yeah, I'd be very happy. Please let me know.
Fantastic. So without spoiling anything, is there any exciting research on the agenda for the likes of yourself and the University of Western Australia you might want to share with us?
Look, there is. So we've got 3 things that I think are probably things that people would be interested in. For those CFOs and accountants in the room and volunteer board members that are accountants, we have the Australian Non-Profit Accounting Standards Research Program that you mentioned in your introduction underway, which involves, led by our university, but involves a number of universities, in which we're really trying to get a definitive and proportionate accounting standards set relevant to the sector. I'm really pleased the Australian Accounting Standards Board has been incredibly supportive of this. The Keith Kendall, the chair, has a very open mind and is really evidence driven. He wants the evidence, and once we've got the evidence, I'm sure the board will respond accordingly. But looking at a proportionate response, I think, is a really important aspect. The second one is a major piece of work, which I think I mentioned in my presentation, but relates to the issue of indexation and what we certainly in academia call the starvation cycle that not-for-profits and charities have been through for the last probably 5 or 6 decades. And that indexation program is really saying we developed actually an indexation model for human services. We call the Australian Human Services Indexation Model, and we're collecting data now to test that model against current indexation arrangements. So it's really important for the sector to understand, again, you know, of all the things that to leave in or to leave out a presentation like this, but the current indexation models, which around the country tend to be a combination of the wages price index and the CPI, are simply not relevant or almost not related to the sector and its operations. They're just not relevant. And so indexes such as industry indexes like the Health Industry Index are much more relevant. And for those people that might care to look it up, if you look at the ABS website and actually search on these indexes, you'll notice that while indexation up until relatively recently has certainly in Western Australia has sat around the 1%, the 1.5%, or rather CPI has sat around the 1.5%. The health CPI at the same time has sat around 4.1 to 4.6%. So we have developed an indexation program that I think, formula that I think meets the need, but hopefully we'll be able to report and to demonstrate the discrepancy that is inbuilt in that funding process. Because if you don't get indexation right over many years, of course, there's a deficit built into the funding arrangements. The final piece of work that we're doing is really looking at this red tape issue, determining what is red tape and what is administrative process that you really need, and trying to understand what the cost of that is. And so we're collecting data to understand and appreciate the administrative burden that's been imposed by things like quality and assurance agencies, increase recruitment retention costs, all of those kinds of things, in order to be able to demonstrate and evidence that cost base is actually increasing for the sector.
Oh, fantastic. I'm absolutely with you when it comes to the cost and administration, most definitely. Yeah. Well, David, I'd just like to really thank you so much for your contribution today. I'm sure that there's going to be lots more questions coming through, and look forward to working with you in the future. Thank you so much. And if you want to hang on and be a participant for the next session, please do.
Thank you, Alison. I really appreciate the opportunity. All the best.
Thank you.